Hi, I'm Michelle Tompkins. I'm happy to be here today with one of our newest specialty physicians, Dr. Eccles-Brown. She's going to be presenting in our Wellness Connection program this month. Thank you for being here with us.
Hi, thank you for having me.
Well, welcome here to Shell Point, and thanks for presenting in our Wellness Connection program. But first, I want to tell our residents a little bit about you and when you're here at Shell Point.
Well, great. I first started coming to Shell Point this past summer when I joined Dr. Almquist here in practice. Prior to that, I was active duty Air Force, and my husband and I were stationed at Eglin Air Force Base in Northwest Florida. Since we moved here last summer, I've really just was initially filling in for Dr. Almquist when he was out until just at the beginning of this year, I started to come every Tuesday afternoon. So I've had the pleasure of getting to know a lot of wonderful people here at Shell Point.
Well, we are very happy to have you here, and let's talk a little bit about the program. It's called Age-Related Macular Degeneration. Now, eye health is so important to us and our residents, and we've heard the term macular degeneration. Can you tell us exactly what that means?
Absolutely. Macular degeneration involves the central portion of the retina. The retina is the thin wallpaper that lines the back wall of the eye, and that central portion is called the macula. That's the prime real estate back there that helps to provide you with the central part of your vision, the part that helps you be able to see when you're reading a book, you know, to be able to read the words, to make out the details in somebody's face, and to see fine detail in anything that you're really trying to focus on. And so very, very important part of the retina that's involved there. And it's a very, very common disease. It actually affects over 10 million Americans. And so this is something that we see very commonly. And there's different levels of how much it can affect your eye. There's two types. There's wet macular degeneration and dry macular degeneration. The dry kind is far more common, and it really tends to progress very slowly over many years to affect that central part of the vision, where even with glasses, we're not able to improve vision back to 20/20 or to what it was before.
And like I said, eyesight is very important. I know many years ago my grandmother had this, and it affected her depth perception walking downstairs and being able even to push numbers on a telephone.
Absolutely.
So it's important that if our residents see these signs and symptoms early, they of course get them checked out. Tell us what some early stages or early signs may be.
Absolutely. So what patients may notice are that straight lines no longer seem straight anymore. And usually when we make this diagnosis, we will give our patients something called an Amsler grid. And it has a little vertical and horizontal black lines. And patients are instructed to look at a little black dot in the center and basically use their peripheral vision to see, are there any areas that those straight lines no longer seem straight. And for patients who have dry macular degeneration, often the lines will remain straight for a long time. But if at any point those lines become wavy or an area is just abnormal, missing, that is a sign to come in right away, because that can mean that it's no longer dry. It might be the wet type of macular degeneration, and that requires different treatment.
Okay, talk to us about the treatment for even the dry macular.
Well, for dry macular degeneration, we always encourage our patients to eat good, healthy diets, right? So actually a lot of vitamins and antioxidants are important in the health of the eye. And so I always recommend my patients eat a lot of green leafy vegetables and foods that are high in omega-3 fatty acids. Fish, especially salmon, are very high in this. Additionally, there are vitamins for patients who have dry macular degeneration where it's at least moderate or worse. I always recommend that they take vitamins for their eyes. There are many different brands, and any of them are fine, but I particularly will recommend what's called the AREDS 2 formula.
Interesting.
AREDS, I spell it out because it just sounds, you know, it doesn't make too much sense otherwise. But AREDS stands for the Age-Related Eye Disease Study, AREDS. And that is, research that has gone on to determine what vitamins and nutrients are best for the eyes, and has found just the best, combination of these for patients who have macular degeneration.
Now, can this be reversed, or is it something that you'll always have once diagnosed?
Good question. So this is something that is it's not curable. So once it's diagnosed, we know that you'll always have it, and we just need to monitor at least every year. You need a good dilated eye exam to make sure that it's not getting worse, and certainly not progressing to the wet type of macular degeneration.
This has definitely been a lot of useful information for sure, and you're going to be a great resource for our residents in Wellness Connection. So thank you for discussing this with me today. And our residents out there listening, if you're just interested in learning about this, or maybe you should have some of the signs and symptoms, or someone you know, please call the service desk and sign up for Age-Related Macular Degeneration in the Wellness Connection. That's Friday, May 26th at 2:15 in the Social Center with Dr. Eccles Brown. Thanks a lot.
Thank you so much.